Protesters gathered outside the Ontario legislature in Toronto on Saturday. Many of them were parents and educators who are calling for a full return to school in September. They're urging the government to set aside funding for safety measures and infrastructure, so returning staff and students can all be protected. School boards are currently trying to determine what the new semester would look like, whether it'll be a continuation of online learning or a return to class, or perhaps a mix of both. Parents are not the only ones pushing to get their kids back in school. Some doctors are also in favor of this, and one of them is our next guest, Dr. Ronald Cohn. He's the president and CEO of SickKids Hospital in Toronto. Dr. Cohn, good morning, and thank you so much for joining us.
Good morning, and thank you so much for having me.
Dr. Cohen, I do want to talk to you in a moment about the specifics of returning to school and how to protect children in closed spaces and all those things and ventilation systems. But I would actually like to begin with a statement that was issued earlier this week about the long-term impacts of COVID-19 on children. And your hospital put out a statement, including other hospitals, that said COVID-19 has created a crisis in children's health and potentially catastrophic impacts to the physical and mental health of children. What would be these catastrophic impacts, or what are you referencing there?
So if you look at the last few months, our children were socially isolated. They have lost all of their routines. A number of them have lost their lack of social support and the overall heightened anxiety. And if you put this into the context of the Children's Mental Health Ontario, who have now collected some data reporting that 1 in 3 of Ontario parents have reported that their child's mental health deteriorated from being home from school, and over half of these parents are noting behavioral changes like outbursts, extreme irritability, personality changes, and sadness. And if you take this all together in terms of the mental health aspects, then this is something I myself and many of my colleagues are literally losing sleep over. But in addition to that, over the last, I would say, 4 to 6 weeks, we have begun to also be concerned about the physical health impacts. I want to give you a couple of examples. So if you look at the emergency room visits that we have seen at SickKids, they have declined on one hand by 45%, but then in turn, we see children coming to our emergency being actually much sicker than we would have expected them to be. We see more injuries, like burn injuries, that are often due to lack of proper supervision. And last but not least, as every other hospital in the province and in the country had to ramp down a number of surgical and procedural activities, we are now having about over 4,000 children on a waiting list for surgical and procedural activities. And although we are still trying to model this with the ongoing referrals that will come in over the next few months, it will probably take us 18 to 24 months to get through this backlog. So taking all of this together is the reason for why we are so incredibly concerned.
Well, Dr. Cohn, you've listed a number of concerns there, and beyond just these health concerns, there's the implication that, as said in the statement, their human rights are being violated. Would you go as far as to say that?
I think that we all, as individual adults and as a society, have the responsibility to ensure that children are now becoming a priority. I feel like children have been a little bit of the unheard voices of this pandemic. And I think we need to collectively now come together, make children's health and their well-being a priority. And if we do that, then I think we can probably mitigate a number of the concerns that we all have right now.
Okay, well, a big concern for parents is what's going to happen in September. For weeks, for months, many children were not in their classrooms, they were not with their teachers, not with their classmates, and now we're in summer mode. But when September comes, what is your argument? Do you want children to get back in school? Is that right?
That's correct. I think we have to set an ambitious goal here. Our ambitious goal needs to be, let's bring our children back to school full-time, 5 days a week. All of this starts in our community. We have done collectively in Canada so far very well trying to keep community transmission low and at a degree that we can now begin to think, if we can keep it like this, how can we begin to think about getting children back to school in a safe way. We can't just get children back to school like it was in January or last year. It has to be different. We have to have safety measures into place for the children, for the staff members, for the teachers. But I think that should be our goal in thinking about how are we going to make this happen over the next couple of months come September.
Well, who takes responsibility for that, sir? Because ideally for everyone, things would get back to semi-normal by September, but if you can't have about 30 students sitting side by side in rows all together in a classroom anymore, then who's going to pay for expanded spaces, for the protective equipment that everyone might need, for the extra medical staff that might need to be hired, for extra testing that might have to be done if students are coming in and out of busy classrooms? Who has to take responsibility, and who's going to pay for it, essentially?
So when it comes to responsibility, it is all of our responsibility. Everything with COVID-19 in the last few months has been extraordinarily complex in an unprecedented way. And the only way how we can solve any kind of issue and problem, and particularly the one around school, if we all work together, listen to another, and really collectively think about what are the plans that have to be in place and how we're going to try to implement them. It has to be medical health professionals, public health officials, it has to be teachers. There are so many aspects of trying to make this happen that we all have to do it together. It's our responsibility, but it starts with accepting that it has to be a priority. And I'm thrilled to see that over the last 7 to 10 days, the conversation has shifted. It makes us realize our children are a priority.
Okay, Dr. Cohen, let's talk about something else, something some folks might describe as being controversial, which is whether the virus is airborne or not. We've heard from over 200 scientific minds around the world who are arguing to the World Health Organization that yes, in fact, this can be airborne. So on a practical level, and one for children, what does this mean if they're returning to school, if there's bubbles of people, the air around you might be filled with the virus, if it's going through the ventilation systems, how does that get resolved?
It's not the only controversial aspect of COVID-19, but you're right, it has been one of the more recent controversial discussions. I think we all need to take a step back and probably go back to the principle of the 3 C's that has, for example, been incredibly successful in Japan. The higher risk conditions that we are facing sometimes are closed spaces with poor ventilation, crowded places with many people nearby, and then the close contact settings. We have to take those into account as we begin to think about how full-time school can look like. And we do know, even from other viruses that are respiratory viruses, that there's a certain degree how these droplets can travel for a certain distance. It is not, however, though, a classic airborne disease like measles, for example, where you can enter a room. If you have measles, you leave the room, and then 2 hours later, if somebody enters the room, you're at risk of getting the infection. But I think the concept of this closed spaces with poor ventilation, crowded places, close contact settings that has to guide many of the decisions we have to make now.
Dr. Cohen, as we look ahead to September, to the next year, to the next decade, what are your long-term concerns when it comes to physical and mental health of children who are growing up with the pandemic being ever present in their development?
So I have significant concerns, and so do literally thousands of child healthcare providers around the world. We are actually actively studying this right now in terms of what is the impact on mental health on a long-term basis, what are the potential physical impacts. And we are trying to do this in real time to identify certain mitigating measures that we can take along the way in order to reduce those as much as possible. It will undoubtedly have a significant impact, as it already has. And I think that's probably one of the reasons why I myself and many others are now pushing, let's set the goal to send our children back to school 5 days a week, if our community transmission rates allow for this to happen. Because if you weigh this against the alternative, this virus is going to be with us for a lot longer than just a few more months. It's at least a year, if not longer. And the idea of having children isolated and being at home for another year or even longer, to me, is an untenable alternative.
Okay, sir. We'll see how things develop in the meantime. Thank you so much for your time and for your insights.
Well, thank you so much for having me. Have a good day.
You too. Dr. Ronald Cohn is the president and CEO of SickKids Hospital. We reached him in Toronto.